Welcome to the second part of the lecture. This will go pretty quickly too. We're doing the second part, which is the learning objectives, the drug action, and alternative therapies. Again, these are all things that we studied in depth during pharmacology. So this is a review. So the learning objectives: identify the classifications of drug actions, differentiate among commonly used herbal remedies and alternative therapies, explain the role of the medical assistant in drug therapy education, and identify the medical assistant's legal responsibilities in medication management in the ambulatory care setting. Looking at the terms related to drug interactions as a review, antagonism, this is the action of one drug decreasing the intensity, or it also shortens the duration of action of another drug. Synergism, one drug increases the intensity or prolongs the action of another drug. And potentiation, a form of synergism in which the action of one of the drugs is increased by the presence of another drug. In this case, the two drugs have different actions, but one increases the effect of another. So an example of synergism is 3 different antibiotics prescribed to treat tuberculosis, or several different HIV drugs prescribed to treat the HIV infection. An example of potentiation is, the use of Lasix, this is a diuretic, with an antihypertensive medication to more effectively lower blood pressure. So there are some examples for you. We know androgenics, right? Their actions and examples and interactions of use. The androgenic blockers, we've gone through all of these. Analgesics, anesthetics, and acids, and the proton pump inhibitors. Anti-anxiety agents taken for anxiety. What are the primary side effects of these medications? Do you remember? So side effects include agitation, amnesia, bizarre behaviors, confusion. Can also cause the reduced white blood cell counts. I don't think we really talked about that as much. Can cause depression, drowsiness, lethargy, over sedation, and tremors, sometimes photosensitivity. So again, these anti-anxiety agents are things that we looked at. Just trying to question you, see how you're doing. Antibiotics, right? The primary side effects of antibiotics. Do you remember some of those? So hypersensitivity, nausea, diarrhea, GI distress, light sensitivity, and I said hypersensitivity. Hypersensitivity. The medical assistant should ask the patient about their drug allergies each time they are seen in the office. You know this. You have been practicing it. We write it in red, but just continue to remember that that's so important to do. So the anticholinergics, the anticoagulants, the anticonvulsants, antidepressants, antiemetics, antifungals, antihistamines, antihypertensive agents, anti-inflammatory agents. Let's go back here. Anti-migraine agents. We didn't talk a ton about this, but we did kind of mention, I think, in a small part, like the Imitrex and the Zomig. And there are some side effects included in anti-migraine agents. They can include confusion, psychomotor, slowing, difficulty concentrating, memory problems, and rare but serious cardiac events can occur with the anti-migraine agents. The anti-neoplastics, the antipsychotics, antipyretics, these are those topical agents. Topical agents have no side effects. Benadryl can cause vertigo, sedation, and nervousness, but those topicals typically don't show any severe side effects. Let's see. Antipyretics. And again, side effects may include GI disturbances and liver disease for these. Antispasmodics, antitussives or antitussives. Do you remember how we said they can be called antitussives and antitussives depending on who's using it? Tussives is the cough syrup. That's what I think of, like Robitussin. That's a tussive. So either way, I've heard them called both. Antiviral agents, bronchodilators, recrusin, cathartics, laxatives, central nervous system stimulants, contraceptives, decongestants, diuretics, expectorants, hematopoietics, hemostatic agents, hormone replacements, hypnotic or sedatives, lipid lowering agents, miotics, mydriatic agents, narcotics, oral hypoglycemic agents, osteoporosis agents. We've talked about both in pharmacology and ALH for a little bit the herbal and alternative therapies. And then alternative therapies such as acupuncture, chiropractic care, mind-body therapy, homeopathic. And let's look at patient education, because this is always key to everything we're doing. So in patient education, it's important we can make a list of all medications, ask if pregnant or breastfeeding. That's very important because of those medications on the pregnancy list. Pre-assess for adverse effects. If we're going to be dispensing in the office, we want to make sure that we keep them in the office and observe for a minimum of 20 minutes after administration of a medication. This is so that we make sure that there aren't any adverse effects right after they take it, since we dispense it in the office. And we also want to inform them of the adverse effects that can occur at home. And we've been practicing that already with our patient education and our forms. Discuss how and when a drug is to be taken and any kind of storage precautions. Reassess the medication is being taken properly when they come back in, as well as provide comfort, encouragement, and guidance, because a lot of times they're not feeling well or they're taking this medication for purposes because their health is not good. So that's a huge part of our job, guys, is just to provide comfort, encouragement, and guidance. Isn't that awesome? Also, answer any questions and consult the physician if needed. Always consult the physician if you see anything that doesn't look right before you administer that medication. It's okay to ask and make sure, and it can save a life. Really, truly, it can save a life, or save, major side effects that can affect this person for their lifetime. The medical assistant plays an important role in helping the patient understand the medications and promoting that compliance with treatment and preventing complications. So once again, look at that. We are super important. Therapeutic communication with patients from diverse cultures. And again, we've gone over this and how to communicate, but it's so important that we keep working on this and practicing this. So investigate healing practices of primary culture so that you know what is typical for your patient. Encourage cultural sensitivity. Provide educational materials in native language. Ask about home remedies used and share information that you get on this with your physician to try to work together. Health benefits can affect compliance with medication therapy, and health beliefs are really important. What they believe in their culture is what their whole being is. So we need to understand those and work within those and work together. Patients from various cultures may be using home remedies or herbal treatments that could interfere with the effectiveness and safety of medications prescribed by the physician. So again, it's so important to communicate and know and document. There's always, as always, we look at legal and ethical issues as well. It's important that all rules for record keeping, inventory, prescribing, dispensing, and documentation of scheduled drugs are followed according to state and federal regulations. This is huge. So we need to make sure we understand them in order to be able to follow them correctly. What's PHI? You've learned this in your EHR. But PHI is their protected health information, right? So according to the Health Insurance Portability and Accountability Act, which is also known as, yay, yes, HIPAA, patients have the right to request restrictions on the disclosure of protected health information, that PHI, for treatment, payment, and healthcare operations. Okay, so it's important that we understand that and that we always follow those HIPAA guidelines. All right, if you have any questions, make sure that you write them down and bring them to class. I am so excited to see you on Monday. Have a great day. Bye-bye.